So once again, thank you very much for having me here, and my personal regards and thanks to the Vice Chancellor, Rotarian YSR Murthy, and Arpita for coordinating everything. So with that in mind, let's make it interactive first of all, because the whole exercise, the point of this exercise is to understand what challenges women face throughout their life and what are the various interventions that can be done along the way in order to have the best outcomes and best health in the entire life and extend our lifetime, and being basically what I say, fit at 40s, strong in 50s, and independent in the 80s and nimble in the 90s. So that should be our motto, right? Just take my slides forward. So essentially the challenges to women's health, or women's, in general, would be many, very many. So I'll just go along some of these lists, like, about girls having early menarche. That's the first period that they're having. And that unfortunately is becoming earlier and earlier. Way back in the 18th century, the first period would happen around the age of 18, whereas now it seems to be happening much earlier. 9-10-year-olds seem to be having their first period, and we really don't know what seems to be changing, but we do know that what the mother does when the little girl is in her womb also matters, right? So genetics and epigenetics play a role as well. Obesity is really a big challenge, and that in turn leads on to many different changes in the body which can affect future health. So we know obese women are more at risk for cancer, more at risk of heart disease, diabetes, and many of these non-communicable diseases, including reproductive problems. Late pregnancies, again, a very common issue that I see. Women wanting postpone pregnancy or not have a child at all, but mostly late pregnancies when it dawns upon them that the biological clock is ticking way in the late 30s or early 40s even, right? Because of career, because of not finding the Mr. Right, etc. So, and then we have late and early menopause, where we could have an early menopause which is sort of before 45 years, because in India it seems to be between 46 and 48 years of age, menopause, right? The average age. Whereas in the UK, it is about 51 years of age. But I do see women having early or premature menopause before 40s, before 45, or even beyond for 52 and up to 55 as well, right? Environmental stressors, pollutants cannot escape them, multidimensional responsibilities, parenting challenges, work stressors, and whatnot, right? So there's so many things to contend with. So just a little bit of outline, because I would like to talk about health along the way, So let's start with menstrual problems and hygiene, premenstrual syndrome, sexual health, contraception, a bit about pre-pregnancy and pregnancy care, a bit about menopausal care, cancer screening, and of course, how to stay healthy, right? Because I seem to be having only about, exactly.
It's 11:15 because 11:30 we have.
11:15 we'll have to, that's fine. Good. So when I say menstrual problems, we're talking about irregular periods, heavy periods, scanty, even painful, PCOS-related problems, and things like fibroids, endometriosis, adenomyosis. These are all gynecological terms for various conditions, structural problems, and thyroid disorders as well, which can cause menstrual problems, right? So this beautiful apparatus that we all have, women have, is that wonderful, I think I have a pointer here. So that's the beautiful womb, the uterus, which carries, which basically homes the baby all through pregnancy. And when it twins, it have an expansile strength of going up to carrying about 10-11 kgs, right? So you have this uterus, which is just about a fist size when somebody hasn't been pregnant. And that has this is a beautiful NICU that God has given us for looking after young babies, right? And then we have these two tubes, which essentially are the transport system for the egg to be carried into the tube where the fertilization takes place, and then the fertilized egg would come and get implanted in the uterus to kind of become a embryo and pregnancy to go forward. This particular organ, okay, so this is a tube, and then we have the ovary, right? So this is how the ovary would look on the outside, a nice pearly appearance, but this is how a cross section would look. And when you see the cross section, you've got these little follicles which home the growing eggs, right? So what we must understand is that we all are endowed with a certain bank balance of eggs. So we all come with a few million eggs when we're born. But as we age, they're all getting depleted, right? So once we cross 35, these eggs are really, really depleting very fast. So the ovarian reserve keeps going down. So if somebody wants to plan pregnancy after 35, they're looking at a low ovarian reserve. And I'm also seeing a lot of women with low ovarian reserve even when it's not expected to be low. So I think that's something which seems to be happening as well, and that's happening to men as well. So fertility problems are on the rise. So when this follicle matures and the egg releases, that travels through the tubes, right? The ovary also has a function of producing estrogen, which is the women's, the wonderful hormone that we all have, which not only looks after our reproductive health and our periods, but it also gives us our heart, our bones, and the skin, and all the various organs that depend on estrogen, the strength that they have, right? So once the estrogen depletes in menopause, the bones are suffering, the heart is suffering, the skin is suffering. So, most of the organs the aging process becomes faster post-menopause, right? So there are a lot of changes which happen. And then, of course, we have the cervix, which is the neck of the womb, right? And this is where cervical cancer develops from. So when you say cervical cancer, we're looking at this area here, which is the outlet of the uterus. And this is where we take the pap smear from, right? So obviously there's this little instrument which goes in, and very quickly, within a few seconds, we take a brush and take the sample from here. And a pap smear is very important. I'll come to that later. Of course, the vagina is the outlet, the birth canal, the menstrual, blood comes out through there. And of course, sex is a sex apparatus as well. But remember, of course, that, when I say vagina, it's not the same as a vulva. Vulva is a skin outside, right? So having a little biology lesson there, we go ahead. So what are irregular periods? Now, anywhere between sort of 21 to 30 cycles on a regular basis is a normal cycle. But once we go below 21 days or over 35 days, we're looking at irregular cycles, right? And the causes could be many. I don't want to elaborate on that, but you're looking at hormonal imbalances, thyroid disorders, obesity even, stress even. So just a woman having had plenty of stress or exam stress or even travel or anything could even push the period forward. During the COVID pandemic times, we saw a lot of changes happening with the vaccinations as well, right? Heavy bleeding, of course, periods can be prolonged or the flow can be heavy. So either way, it is heavy bleeding. It's very subjective. You don't know how much the other person is bleeding. So there's no way to compare notes. But in general, if you use either a pad user or a cup user, I strongly believe in using the cup, and I'm a very strong advocate of becoming a cupwort. So those of you who want to know more about the cup, you can ask me later. But even if you're using a cup if you're using a cup, you can actually quantify the amount of blood that you're losing, right? Whereas if someone is using a pad, it's very difficult to quantify it. But when you have clots, right, you're passing big clots, that's a heavy one, because normal menstrual blood wouldn't have clots in it, right? Also, if you're flooding, right, you sit on the toilet bowl and there's flooding, or you're staining the linen, or you're feeling extremely exhausted after a period, palpitations, feeling your heartbeat, getting short of breath when you take even a flight of stairs, this is anemia, and that's probably because you're having a heavy period. And again, the treatment can be very simple. It can be non-hormonal or hormonal, but many a times non-hormonal medications do help, and we have various reasons for that. Of course, one is, some things that we cannot see, like ovulatory or bleeding disorders. And some things we can see structurally, adenomyosis, pelvic inflammation disease, uterine fibroids, polyps, cervical cancer, endometrial cancer. These are rare, of course, right? So we have to evaluate such situations. Coming to hypothyroidism, right? Again, very much on the rise, and I don't know why, but when I see preconceptional women who fortunately come for a preconceptional counseling, and I strongly recommend a preconceptional counseling, that is before planning a pregnancy, to get everything checked, we need to keep the TSH, or the thyroid stimulating hormone, below 2.5, and that's a very important aspect. Women may find themselves losing a lot of hair, suddenly feeling, having a brain fog, feeling cold when it's warm, warm when it's cold, anxious, depressed, feeling a bit low in, energy and mood, joint pains, dry skin, brittle nails, weight gain suddenly, memory loss, and even low libido or low sex drive can all mean a possible thyroid problem. Now, coming to a little bit about, continuing about periods, right? Menstrual cups, as you know, they're healthier, they're greener, and I say they are almost cash free, because one cup which costs about 800,000 rupees will last you 8 years. Rash free, certainly, no chafing with the pads and stuff like that, and trash free as well, for a place where like Bangalore, which produces so many tons of sanitary waste, including diapers and this and that. This makes so much of sense to the environment, right? It just collects blood, it doesn't absorb it. It just goes and sits inside the vagina and collects blood, and it forms a seal with the vaginal walls, and hence doesn't leak as well, unless it's filled. A little bit about contraception. I'm sorry, I'm really rushing through because of, I want more time for the interaction, if that's okay. Is that okay, or am I zooming past? We're okay? Yeah. Now, coming to contraception, so many couples tend to use the natural natural methods like pull out or, fertile period and all that. But those who have irregular periods, it's really not an effective way. Even otherwise, it's not an effective way. We have almost 40 to 50% failure with this, right? So you've got to be extremely careful. And then female condoms, not very common and not very effective either. Male condoms, of course, again have 10 to 15% failure rates, right? So you can't entirely rely on that. However, youngsters can find it, definitely should use that along with something else effective to prevent sexually transmitted infections. Injectables, again, cannot be given in long term, but definitely a good way of, family planning. Intrauterine devices, there's a lot of myths associated with intrauterine devices. People think that it's not really right to put something into their body, but they're so well tested along the years and have given such effective contraception, and it's absolutely non-user dependent. You don't have to remember to take pills. Once it's in for 3-5 years, even 10 years, even 10 years even. The copper T one, there's one for 10 years, and there's a hormone releasing one as well as a copper releasing one, and the hormone releasing ones work really well for those who are having heavy periods as well. And then, of course, the birth control pills, the oral contraceptives, they have multiple uses in gynecology for women's health. Not only do we use it for birth control, we use it to control irregularities, sometimes PCOS, sometimes for adenomyosis, etc. Contraceptive patch just coming into the market, not very easily available. And then there's one more implant which is not sort of depicted here, but it's a little rod which is almost about this size, the size of the handle. Can you see that? It's a silicone little rod which releases hormone, and it goes and sits under the arm here. So we insert it here under the arm, under the skin, and you won't even be able to feel it unless you press really hard. And it's not going into the uterus. So that works for 3 years and is a very effective contraceptive as well. That's called an implant, right? Yes, sexually transmitted infections, again, a very important topic. We know of a few, but there are so many out there, which people with multiple partners or, unprotected sex or, one-night stands can suffer from, because you've got not only HIV, hepatitis, you've got herpes, syphilis, chlamydia, trichomonas, mycoplasma, gonorrhea, shigellosis, whatnot, right? So it's important to understand that condoms do prevent, but not in all cases. Say, for example, HPV, which causes the human papillomavirus, which causes cervical cancer. Condoms alone will not protect one from the STD itself, right? So that's why I'm going to be talking about the vaccination. So it's important to realize that it's not, I've only had one partner. Should I get tested for STDs? Of course, you must. because even with one partner, you can still have it. You can tell if someone has an STI by just looking at them. No way. You can't even tell if the discharge is different. No, because that's not the symptom. It could be a completely inert, asymptomatic infection. If I needed it to be tested, my doctor would automatically test me, right? No. So now that's not something that, of course, we do ask history and we do offer it, but we don't automatically do it unless you know what it is and you actually ask for it. So you can't get any STIs from oral sex, right? Of course you can. I've had a pap smear, so I've been tested for STIs, right? No, pap smear only tests for changes in the cervix which happen way after the HPV infection happens. So this could be 10, 12, 15, 20 years later that changes happen. So even if you've had a vaccination, HPV vaccination, a pap smear is required, and a pap smear is not a test for STIs. STIs are not only tested with blood tests, they're also tested with an endovaginal or endocervical swab. People think, many young girls whom I see, assume that just the blood test would do to check for an STI, and that's not the case. It has to be done in 2 ways. I don't have symptoms, so I don't need to be tested, right? Of course, as I said, they may be completely asymptomatic. So having said that, how do we prevent it? Just the 2 things: condoms, HPV vaccination, but of course being careful as well, right? Infections, the other infections like, fungal or bacterial infections of the vagina can happen. So anybody who's having a bit of a curdy discharge, greenish, yellowish, different color, or itching or odor or burning urination, or even fever and abdominal pain must get checked for other infections which can affect the pelvis, right? The pelvis and the uterus and the other organs. Coming to a little bit about pre-pregnancy care, as I said earlier, the preconceptional counseling, I cannot tell you how important it is. One who's had a proper, thorough preconceptional counseling will have a good start to pregnancy and a smooth ending. So no doubt you must see a gynecologist before planning a pregnancy. And importance of booking early, that means you need to see a doctor as soon as you fall pregnant. As soon as you get pregnant, because the more delay there is, there will be delay in interventions that may be very important, right? And regular antenatal checks, vaccinations along the way, and checks for all these anemia, blood pressure, high blood pressure, diabetes checks, etc. There's a particular condition called gestational diabetes which happens in pregnancy, and that's high sugars in pregnancy, right? That's essentially because the hormones of pregnancy make the sugars go up, and unless one has enough insulin, which is being produced by pancreas, it will not get controlled. And so the sugars keep going higher in pregnancy. And that needs to be identified early so that we can put, proper checks along the way. This is more common in obese women with PCOS, women with family history of diabetes, or women with previous diabetes in pregnancy, right? Or women who've had very large babies in pregnancy, most likely to be diabetic because of diabetes. And coming to menopause care, firstly, what is menopause, right? Menopause is a situation, or it's essentially it's a retrospective diagnosis. We can't say somebody's actually gone through menopause unless they've not had a period for a whole year in the menopausal age. So unless they've had no periods for a whole year, you can't call it menopause, right? And what is happening here is the estrogen hormone is getting sort of completely depleted. And because the estrogen hormone is getting depleted, they start facing various symptoms. Now, what are the various symptoms of menopause? Maybe we should start making it a little interactive because we have enough time. Right. Yeah, I was a bit conscious. Now it seems to be okay to start some interaction. So what are the signs of menopause? Anybody? How are the symptoms, rather?
Hot flashes.
Absolutely. Hot flashes. Who's that? Right. Yeah. Anybody else? What else could happen around the time when a woman is going through that 1 or 2 years before the actual cessation of periods?
Mood swings.
Mood swings, absolutely, right. Yeah. Yeah, it could happen. The perimenopausal hormonal fluctuations can cause either irregular periods, excessive bleeding, or shorter, frequent periods as well, right? Nothing else? What could happen with estrogen deficiency? Weight gain, absolutely. Central obesity, you have more tummy coming up, so a lot of fat in the abdominal region. Anything else you can think of? Anemia, not per se because of menopause. No. Hair loss, yes. Yep. So yeah, I mean, it can head to toe if you want me to go through all of it. Hair loss, yes. Changes in the skin, right? So dryness, losing the collagen or the elasticity of the skin. So a lot of wrinkling, some amount of visual changes. Of course, even all the sense organs may be affected. Then brittle nails. But most common, let me go from common to uncommon, are vasomotor, which are like hot flashes, cold sweats for no reason, sweating. Suddenly a woman just has intense sweating for no reason, and the husband might be wanting the AC off and she would want the AC on, and that sort of thing, right? Sleep disturbances, very common. Mood disturbances, feeling very irritable for no reason, right? Just snapping at people around her for no reason, or feeling very tearful. Even, a sentimental movie scene which never made her cry earlier would make her cry, right? Also, anxiety and depression, common in the perimenopausal age group. Also, aches and pains, bone pains, backache. So if somebody is osteoporotic or osteopenic, which is poor bone strength, they may have aches and pains, again, arthritis. Sometimes autoimmune conditions get flared up. So if somebody already has autoimmune conditions, they get worse, right? Thyroid disorders can set in around menopause, right? So these are all some of the, and of course, very importantly, genitourinary symptoms. Let me finish this. So just genitourinary symptoms like vaginal dryness, low libido, low sex drive. Also, what we call urinary frequency and stress incontinence, where she coughs or sneezes and then she leaks urine, right? So that could be happening because of the lack of the strength in the urethra, or this little tube which connects the bladder to the outside. So that could happen as well, right? So these are all the symptoms that can happen. Yeah, your question. Yes, absolutely. So that was the next thing that I was planning to cover. So yes, you're absolutely right. So those women, so I will start relating one phase of life to another a little later, but this is important to understand that some of the health risks are associated with what the mother faces, what the lady faces in her pregnancy, right? So for example, a woman who's had gestational diabetes in pregnancy, or hypertension in pregnancy, or have had some other adverse risks in pregnancy, she may have a higher risk of developing problems in around menopause, hypertension, cardiovascular disease, high cholesterol causing blocks in her arteries, diabetes, cancers, etc., and osteoporosis. So when I say osteoporosis, those of you who've had a strong family history, who have a family history of osteoporosis, like, a bent back or easy fractures, very, just a little fall and they have a fracture, right? The elderly women in your family, then it's likely that the osteoporosis runs in the family. Those who are obese are more likely to have osteoporosis. Those who've had steroids for some reason are likely to have osteoporosis. Family history, steroids, obesity, also smoking. So these are all risks which increase the risk of bone loss, right? So hence, what do? We particularly focus on these aspects in menopausal women, and hence when we see anybody who's going through, in fact, I do an opportunistic screening. Whenever I see a lady coming with her mother or mother-in-law, I do sort of do a combined screening of everything. Similarly, when I see a lady coming with her elder daughter or elder son, I'm already looking at who else is in the room and trying to, make sure that the entire family is healthy, right? So I strongly believe in a holistic family care. But yeah, what I was trying to say was, in a lady in the perimenopausal stage, they have specific sets of blood tests. So coming to blood tests, this fad about getting blood tests every year on their own, right? And especially with these, what do you call them? Packages and the comprehensive health packages, which are aggregators. Yeah, aggregators, right? They're called aggregators like Uber and Ola and stuff like that. Similarly, in healthcare, there are a lot of aggregators. So what happens is they offer a lot of tests. which may or may not be necessary, right? And they tend to cause a lot of anxiety in people who actually go through them. Some people just get it done and put it in their shelves. That's a different matter. But those who actually go through them and see the highlights are worried about some of these highlighted issues. So to be honest, they should be very tailor-made. There are some tests which have to be done for certain phases of life, and the sex matters as well. So for men there's something else, for women there's something else, adolescence is something else, menopause is something else. So that's very important to understand. So for menopause there's a certain set of blood tests. There's a pap smear, which is a cervical cancer test. There's a breast cancer screening. There's also the bone health screening, and there's a heart health screening. So that goes together, right? Some people have put in a menopause package, but again, may not be the most comprehensive one. So it's important to get a consult and then probably go over the tests. Also, health risk I've already talked about. What are the prevention interventions that we can put in other than screening? You've got to get the right sort of treatment done immediately, and that is when you have the screening coming up here. So when you talk about screening, and we talk particularly about cancer screening, right? We're talking about cervical cancer, breast cancer screening, and general screening for heart and bone health in menopausal women. But in adolescents, it could be general screening for anemia, thyroid diseases, vitamin D deficiency. For a pre-pregnancy, it could be general screening for fertility, it could be for thyroid, it could be anemia. So it's all general screening differs in different phases. When you come to pap smear, the pap smear is done after the onset of sexual activity, right? Not necessarily marriage, but sexual debut. And it's generally in India, we do it every 3 years. In the United States, they do it every year, right? In the UK, we do it every 3 years, right? So it is repeated every 3 to 5 years. 5 years only in case it's HPV negative. So now what we offer is pap smear with HPV screening as well. So when we have somebody who's pap smear negative, HPV negative, they can just have one pap smear in 5 years of time. There's also a wonderful vaccine which has been there for a long time, has been there for nearly, if I'm not wrong, 20 years or so. But in India, it seems to be just being introduced into pediatric immunization schedule about 4-5 years ago. Even now, not many pediatricians give it automatically unless you ask for it. Some pediatricians are more proactive than the others. But I personally keep it in my clinic, and it's there in my hospital. I give it to opportunistically as a catch-up. Of course, from 9 to 15 years of age is when we give it for girls and boys. Remember that. 9 to 15. And those who have not had it, up to 25 years catch-up. Up to 25 years of age. And those who've not had it even then and who are much more older, they can have it anytime until 45 years of age, right? And this gives protection up to 90% for somebody who's an adolescent, but up to 50 to 80% for somebody who's beyond that age. And it's very well tested. The one single brand which is, has a monopoly at the moment is expensive, but it's very well tested and very well tolerated as well. So hardly any side effects. It can be given up to 45 years, as I said. So this is pap smear, right? When you see what is being done, it might look a little queasy, but to be honest, it's a very simple test. And a little metal speculum which goes, it might feel a bit cold, slightly uncomfortable. You take this long plastic sort of straw-like thing with a brush at the end of it and just rotate it once and we're out. That's it. It's very simple. Less than a few seconds. So people get worried about a pap smear, but I pride myself in saying that I'm probably the best pap smear taker in Bangalore, because many women have said, oh, I didn't feel anything at all, right? So here is cervical cancer. So this doesn't happen overnight. Okay, it takes years and years to form cancer. What we are trying to pick up is abnormal cells called precancerous cells even before the cancer starts. And that's the whole point of doing pap smear, right? One may not experience symptoms until it reaches this stage. So unless there's, some sort of a invasion into the tissue, then one may not experience bleeding after sex or bleeding in between periods or even pain or a foul, smelling odor, etc. So we are trying to pick it up early. That's why cancer screening is important. Similarly, this is that beautiful virus, okay? It looks so beautiful, but that's what's causing cervical cancer in 99.99% of the cases. That's the human papillomavirus, right? And that's why there's a vaccine for it. And this is probably the only only virus which is cancer producing and can be treated, sort of prevented by a vaccine, right? But this doesn't necessarily only cause cervical cancer. It can cause vaginal cancer, vulval cancer, warts, and in men it can cause penile cancer and, essentially penile cancer and oral cancer as well, right? So that's why we're trying to treat that, or rather, eradicate this cancer with vaccination. Now, coming to breast cancer awareness, right? It's important for every lady in her 20s, 30s, 40s, 50s, 60s, along, entire life to start doing self-breast examination once in about 2-3 months after a period, in front of the mirror, in the bathroom, naked, with the pulp of their fingers, a pad of their fingers, and doing either a rotational movement, right? Or a up and down movement in order to pick up lumps along the way, right? So you will feel some lumpy regions, right, along the way, or any changes in the nipple, any discharge from the nipple, or any puckering of the skin. So these are the signs of breast cancer. But again, these are all very late signs of cancer. So as you can see here, the lump, right? And the lump need not be cancer, by the way. There are many other lumps in breast. So don't worry that all lumps are cancer. There are fibroadenomas, a fibrocystic disease, various other things. Skin dimpling, then the change in skin color, changes in how the nipple looks, like it might even feel like an orange peel, right? The puckering. And then, of course, clear or bloody fluid coming out of the nipple. So these are all signs to be looked out for. But these are all maybe late signs. So this is what we're trying to make you understand, that you must do a self-breast examination starting in your 20s. And then we go on to do clinical exams. So I examine every woman who comes into my clinic or OPD will get a breast screening. At least a breast examination, and accordingly further screening. A mammogram is not something which a 30-year-old should be doing, right? Not even 20-year-olds. Mammogram is only for after the age of 45, at least 40. So those of you who might be offered a mammogram in your 30s when you go to a diagnostic center, there's really no need to do it. And that's why I'm talking about comprehensive packages after seeing a gynecologist. So schedule a mammogram every 1 to 2 years after the age of 45. And this basically is slightly painful, as you can see so as you can see, the breasts are sort of compressed between two metal sort of plates, and that's when we get a better image. But it's like literally seconds, okay? So it should be fine. Right, having said that, I'm going to take a short break to see if there are any questions so far.
You were talking about the human papillomavirus.
I was talking about?
HPV.
Yes.
Vaccination can be given even after 40s.
Yes, up to 45 you can still take it. In fact, even later, but the efficacy comes down. Yeah. And now coming to the picture about, health, how health interventions can be done along the way. This picture is basically to tell us that we must do our own shopping. We must try and inculcate all the colors in our plate. And we must make sure they're fresh and preferably organic, and wash them thoroughly. As you can see, many of them are, especially mandis, they are really, really dusty and may have worms, the eggs from worms, which can infest our intestine and take out all the nutrition in the food, right? So it's important to have all these colors because, for example, carrots have carotenoids, greens have iron, etc., right? I show this to especially youngsters, colleges and schools, for encouraging them to go shopping with their moms. So this is a healthy smart plate, right? I think I have a page, yeah. And iron-rich calcium. So for women especially, not even for men for that matter, iron and calcium-rich foods, soya-rich foods for menopausal women, iodinated salts, of course, and deworming regularly, right? So all families must be getting deworming done every 6 months or so, right? This is something that probably is the most important slide of the whole presentation. So when we look at a healthy, balanced meal, we're talking about a balanced and a timely diet, right? This goes out of the window many a times. It's not timely. So you have different times and late breakfast and whatnot. The body needs to be fed at regular intervals with the right things. So half the plate of greens and veggies, quarter plate whole grains and quarter plate proteins and only quarter plate preferably whole grains, right? What South Indians generally do is plenty of white rice and a very little of, fruits and palya and sambar. So we're looking at reversing that into more greens and veggies and less of rice and less of chapati and whatever carbs you're taking. Plenty of water, of course, 3 to 4 liters of water, irrespective of the weather. Fats and oils, let's say 3 to 4. If it can be limited to 3 to 4 teaspoons, that'll be great. But if not, 1 to 2 tablespoons, right? And another important thing is mindful eating. And the youngsters especially, they don't eat mindfully anymore. And I think many a times we don't either. So it's either television watching or chatting with friends or something else on our minds, right? So I think it's important to chew 15 to 30 times every single meal, because otherwise it's not going to get assimilated. It's just going to go down the drain. Similarly, we're talking about balancing other aspects of life with spirituality, relationships, physical activity, and career, right? So that's a smart plate for you. And coming to this, again, an important slide in the for the current generation especially. And so if you can just look at this donut, which has about 242 calories, you know how much you've got to do to kind of burn that? Got to do 88 minutes of crunches, right? A milkshake, which is one of those heavy ones, 780 calories, 72 minutes of skipping, right? And we're hardly doing, I especially don't do 72 minutes of jumping rope, right? So 148 minutes of brisk walking if you're having something like a cheesecake, right? So there you go. So think before you eat, because essentially you're putting it all around your abdomen. First of all, we are thin fat Indians. We're called thin fat Indians because although we may look thin outwardly, we have a lot of fat around our viscera or around our organs inside our abdomen. So we've already put ourselves at a higher risk of diabetes and non-communicable diseases. So we've got to be extra careful about what we do. And this again is a very important slide. Core strength, right? When I say core, it's from the ribs down to the pelvis, front and back, right? So you have good muscles there, and that also signifies the visceral fat inside, right? So good core strength has plenty of health benefits. Improves stability, avoids all those knee pains and joint pains, improves range of motion, improves even mental function. It boosts mental function and even improves your emotional health. So lesser stress, lesser anxiety with a good core strength. So please focus on not only aerobic exercise, but also a good core. I see a lot of women, especially when I examine them post-delivery, I'm very, very keen on them getting back to optimal sort of weight and fitness within a year of their pregnancy. So this is something which I hold very dear to in my heart. And then, of course, the Surya Namaskar, which again is a beautiful thing that our tradition teaches us. A complete body exercise, good flexibility, good circulation, and also, can be done fairly easily, right? So this is what you feel before a workout and after a workout. Right? So please harvest that and enjoy it. Meditation, no doubt, all the CEOs, all the people who've done well in their lives have meditation as part of their lives. How many of you meditate here? 3 hands going up? 4 hands? 5, 6 hands. Yeah. So, yeah, consistency, right?
That's very true.
Yeah. So we know a lot of benefits from that as well. More than anything else, it along with breathing exercises, it activates our parasympathetic system. We're all running on a high sympathetic drive. Sympathetic system, parasympathetic system, two things that balance our bodies in various ways. So we have to activate our parasympathetic system at least once a day in order to be able to manage the stress of the day. So this works that way, right? Hobbies, most of us may have forgotten our hobbies. Must get them back, get them going, because that's what gives you the you live rather than exist when you have your hobbies alive, right? And stopping smoking, because we know that smoking has plenty of other let's say ill effects other than lung cancer and oral cancer, skin damage, also changes in the bones, reproductive health. Those who smokers and fall pregnant have higher risk of bleeding in pregnancy, smaller babies, preterm delivery, etc. Right? So yeah, as gynecologists, this is what we offer, right? And I offer all of it except IVF, but fertility up to IUI. But these are the things that you can sort of ask for, including things like family planning, safe terminations, prenatal counseling, etc. With that, I come to the end of my presentation. And sorry, that's my previous hospital. I forgot to change that slide. It's Fortis La Farm, Richmond Road. Now I'm in Cloudnine, Jayanagar. But thank you for your patient listening. I think you were all intently listening. I could see that. Thanks for that.
Right.
And
thank you very much, Dr. Aruna. And I now understand, it is not a matter of 1 hour. We probably needed maybe 4 or 5 hours to have these discussions. We are looking forward to have you more often.